All right, good afternoon, everybody. Thank you all for being here. My name is Ashish. I'm the faculty director of the Harvard Global Health Institute and a professor at the School of Public Health and Medical School at Harvard. I am thrilled to bring all of us together here this afternoon for a topic and a project that Kamran Abbasi, my partner in crime in this effort that we have been engaged in over the last 2 years, is going to lay out more. But the BMJ and the Harvard Global Health Institute has been working for the last couple of years on a whole series of work around effective UHC, effective universal health coverage. And in many ways, it culminates with a series of papers coming out this week, one of which is by Rene Salas, you'll hear more about, which links two critical global agendas: the agenda around fighting climate change with the agenda for getting health for all, that we call UHC. Kamran is the executive editor of BMJ. He is a bit of a cricket nut. So if you follow him on Twitter, you'll see more tweets about cricket than you will about healthcare, health policy, or even about BMJ. Without further ado, Kamran Abbasi, the executive of BMJ. Kamran, thank you for being here.
Ashish, thank you very much. He captured me perfectly there. And I'd like to thank him and his colleagues at Harvard for hosting us here today. But thank you most of all for the partnership in producing this collection of articles on a very important theme. Can I just say a little bit about the BMJ in case some of you aren't aware or perhaps slightly out of date about what the BMJ is. The BMJ is an international medical journal. We have offices in New York City, Delhi, Beijing, and also London. We have over 25 million people come to our website every year, and most of those people are from outside the UK. A lot from the US, a lot from Asia, a lot from Africa. So it's a very global readership. And I want to tell you about our values, because these matter a lot in relation to the work we've done. Our values are these four particular values that we've focused on. One is being evidence-based, which you'd expect from the BMJ. Secondly, we pride ourselves on being patient-focused and focused, and that includes the public and citizens. We want to be open and transparent, and I believe we are that. And importantly, again, we want to be courageous and ask the difficult questions. That's what we translate that into, and not be afraid to speak truth unto power. And these are very pertinent for both these difficult topics of universal health coverage and also climate change. Primarily, though, we want to create a healthier world, and that means two things: a healthier world for people and the planet, and that's why they come together perfectly for our gathering today. So, when we began this work with Ashish and colleagues, it's been a 3-year enterprise. And we've put together a marvelous collection of articles. And you can see them all on the BMJ's website. They're all there, bmj.com. You can read individual articles, or you can download an ebook and browse through it at your leisure. But the reason we did it was that we all believe in universal health coverage. We are very supportive of it. But from our perspective, we wanted to ensure that there was a quality focus and a focus on making sure that universal health coverage is effective. Because anybody that knows the BMJ also knows that one of our campaigning issues is concern about too much medicine and the danger of just delivering health care, because primarily we want to minimize harm. In fact, do no harm is something that we want to live by, to do better by our patients. And if that's informed by the evidence, then that's really going to make a difference. So we put this together to very much focus on bringing quality into to the forefront in the agenda, and the concept of effective universal health coverage. And we're delighted that not just through our efforts, but those two themes are very prominent in all the work that you will now see about universal health coverage. Above all, the BMJ is about debate. We think there are very few truths in the world of science. Science, by its very nature, is an ongoing debate. And what we want to do is influence that debate, and we've been very fortunate that in relation to this particular collection of articles, we've been able to influence that debate. Last year at the World Health Assembly, that was a very important moment for us. And now that we gathered here for the UN General Assembly, we can focus in more specifically on the urgent question and the challenges posed by climate change. So before we devote more of our attention to climate change, let me just tell you about a few of the other pieces that you'll find online if you visit the website. The first piece is really a piece which is dissecting the quality argument by myself, by Ashish and colleagues, to really help people understand why quality is important. So I urge you to read that one, because that's really a central argument in the case that we're making. There is, of course, the piece on climate change, which Rene is going to talk about today and our panel are going to discuss. But we also cover the topics of mental health and the challenges in delivering mental health in line with universal health coverage, and primarily in primary care. We look at the thorny issue of who should deliver that care. Should it be doctors or other health professionals? We look at the issue of trust by taking the example of the recent Ebola outbreak and the effect on trust it had on the population, and how we overcome those challenges. Something also mirrored in the concerns around the MMR vaccine that we see globally, which has led to a breakdown in trust between professionals and the public. How do we overcome those issues and in order to help us achieve universal health coverage? We also examine the issue of whether or not poor quality drugs will become more commonplace if there is a push to promote drug therapies and to distribute them cheaply. In addition, we have 3 case studies. One is from Argentina, and that focuses on how Argentina can maximize its delivery of universal health coverage. We have another one from Liberia, which is looking at the effectiveness of community health assistance, and a third one from India, which looks at artificial intelligence and the role that can play and the potential harms that might pose for us in terms of the issues we're trying to address. So I'd urge you to look at the collection. There are many other pieces on our website. There's been a lot of hard work put in by Sophie Cook, my colleague who's here, and also the team at Harvard to create these pieces. And we think they're addressing some of the real challenges in delivering universal health coverage, and the arguments there are put very powerfully and very neatly. So, climate change. It's something we are very active on at the BMJ. We're part of something called the UK Climate Council, which is really pushing for action on climate change. In 2014, we published a paper which detailed the evidence around the science on climate change. At that time, there was a lot of debate and doubt around the science. We published a piece that made the case that, based on science, that climate change is real, that humans contribute in a very, very major way to it, and that there is harm to human health. So there were 3 points addressed based on the science. So it's something we've had a stake in for a long time, and we'll continue to do so. We have another planned series of articles on health in the Anthropocene, and that's how we as a human race can respond to the challenges of climate change and reduce our contribution to the harm of the planet. So that leads us to what we're all about at the BMJ, which I've already mentioned, about a healthier world. We want to create a healthier world, which is for the people and the planet. And we believe those 2 issues are inextricably linked, and we're going to hear more about that very shortly from Rene. But before I hand over to her and introduce her, I would like to say just something from my personal perspective. I mean, I think that we cannot achieve what we're hoping to achieve without radical reform of society and of our civilization. We're in a world which is focused on wealth and profiteering. And my personal view, if I'm allowed to give it, is that we need to shift our focus to health and well-being, And if it's the health and well-being of people and the planet, we will end up in a better place. So that's my plea to you and to anybody attending the UN General Assembly. And I'm delighted to see that even this week, Ilona Kickbusch, who will be speaking later and joining our panel, and others have been involved with launching a global action plan for health and well-being, which involves multilateral agencies. I'd urge you to take a look at that, and also to look at another document that Ilona's worked on, which is entitled Health, a Political Choice. And I hope you'll be convinced by the arguments that mean that health should be central to everything that we do in the reform of our own actions and in the reform of the society and the world that we live in. Okay, so I'll be speaking to you at the end, but now it's my honour to introduce Rene Salas, who's written the article in our collection on climate change and universal health coverage. Of course, climate change has been a dominant theme this week, very hard to escape, and rightly so. And I'm looking at Rene's biography here, and I can't quite believe how much she's done, because when she speaks, I think you'll realise that she's done a lot in a short amount of time. So Rene is a clinical instructor of emergency medicine at Harvard. She's an emergency medicine physician at the Massachusetts General Hospital. She's worked at the Cleveland Clinic Lerner College of Medicine. She concurrently obtained a Master of Science in Clinical Research from the Case Western Reserve University School of Medicine. She received a Master of Public Health from the Harvard T.H. Chan School of Public Health with a concentration in environmental health while completing a fellowship in wilderness medicine at Massachusetts General Hospital. Now, if that wasn't enough, she now has a sole academic concentration, thankfully, on climate change and health. And as a 2018 Burke Fellow, she is addressing the current research gaps in this field. We're all grateful to her for doing so. That's a very impressive list of things. And finally, if I'm allowed to say this at a BMJ event, I think I can, because we're all in it together. She serves as the lead for the 2018 Lancet Countdown on health and climate change on the US side. So she's a nationally respected and recognized leader in this field. I'd like you all to welcome Rene Salas. Thank you.